Hey guys, okay, I'm going to do my speech on OCD, that stands for Obsessive Compulsive Disorder, and I just wanted to kind of shine light on how serious the illness is, because I think a lot of people don't really know that. So first, I'm going to talk about the history of it, so here we go. Okay, so OCD first appeared in the 1600s. A man named Jeremy Taylor was having obsessive thoughts about his scruples. He was a bishop in Ireland, so that's when OCD first came about. In the 1800s, psychiatrists thought that obsessions were delusions and compulsions were impulsions, which was wrong. OCD was also once thought of as partial insanity, so they actually thought people with OCD were insane. They also called it Grübelsucht, which means racking one's brain, and that's German, of course, and that's where it was introduced. OCD was first introduced in Germany by a doctor named Westphal. OCD has come a long way since then, thank goodness, and now we have lots of treatments so that they can lead a normal life. Okay, I'm going to go on with a personal story. This is about a girl named Jennifer. Of course, I used a different name because it's pretty personal, but she was diagnosed when she was 11 and had obsessions about her parents dying. So those were her obsessions, and her compulsions were washing her hands and doing all sorts of stuff like that. She would stay up late in the night and she'd wash her hands until they bled. And to the point where she almost committed suicide. She also was paralyzed. It was just really awful for her. She's one of my really good friends as well. But luckily, medication and therapy helped her, and she's now quite older, and she leads a normal life. That's another thing I wanted to shine light on, are the suicide rates with OCD. Attempted are between 5 and 25% of the patients, and 10% actually commit the act. So that's a pretty high number, considering. Also, a lot of people get OCPD and OCD mixed up, so I wanted to talk a little bit about the differences. OCPD is a personality disorder, so it's obsessive compulsive personality disorder, and OCD is an anxiety disorder, just standing for obsessive compulsive disorder. So OCPD, I wrote down a couple of quotes here from a medical site from Stanford University. So here's one quote: OCPD displays a pervasive pattern of orderliness, perfectionism, and/or mental and interpersonal control, at the expense of flexibility, openness, and efficiency. Okay, and so here's another quote. This kind of compares the two, OCPD and OCD. Within OCPD, the driving force is to avoid being wrong. In contrast, the underlying rationale for someone with OCD would typically be to make the correct decision so that nothing superstitiously bad would happen. So basically, Monk, for example, he has OCD. So, he orders stuff in order. He's a perfectionist. And so when someone says you're being OCD, they probably actually mean you're being OCD. So OCD has both obsessions and compulsions. I'll give the definitions of those. Obsessions are unwanted thoughts, feelings, and ideas. Compulsions are the behaviors to get rid of the obsessions. So it kind of lowers their anxiety quite a bit if they do those compulsions. Okay. So now I'm going to go on to the treatment options for OCD. There's quite a few. The medications that are used with OCD are typically antidepressants, or SSRIs, selective serotonin reuptake inhibitors. Serotonin is a chemical in the brain that is said to at lower levels cause depression, OCD, and many other mental illnesses. You may have heard of some: Zoloft, Paxil, Prozac. Sometimes atypical antipsychotics are prescribed, like risperidone and olanzapine, if the illness is really, really bad. Also, a really important thing for OCD patients is cognitive behavioral therapy or exposure therapy. Basically, they're exposed to the fears until their anxiety subsides. So an example of the exposure therapy, I actually saw a documentary one time. This girl had thoughts of killing her parents, or people in general, and so she had to hold a knife to the psychologist's head, and the psychologist kept saying, "Are you going to kill me? Are you going to kill me?" Of course she didn't, and that really helped her anxiety be lowered because, you know, nothing happened. So that's an example of exposure therapy. Finally, there is a thing called the modern lobotomy. This is mostly used for OCD patients. A lot of people think that it's used for schizophrenia or bipolar disorder, but actually OCD is the one that, OCD patients are the ones who get most brain surgery, stuff like that. So, the modern lobotomy, what they do is they open up your brain, of course. I know it's kind of bad, but they don't use an ice pick like they used to. They actually use radio frequency waves to destroy brain tissue thought to be associated with mental illness. So basically, that's just a little short spiel about OCD. There's a lot more complexities to it, and there's a lot more being explored. But I think that's pretty much what we need to know, is that it is a serious mental illness and not something to be joked about. So thank you very much, and that concludes my speech for today.